What's been known for some time is that the majority of breast cancer that's diagnosed in this country, whether it is in African American or white women, is estrogen receptor positive. That's what majority of women are going to get. Majority of women get breast cancer in their older ages. That's why age is the most important risk factors for breast cancer. But then we have an unusual phenomenon where young women get breast cancer. And among the youngest age group, African Americans seem to have a much higher rate than any other ethnic group in this country. And that's where we see the disparity. I've been a medical oncologist for more than 25 years. And one of the things that's now emerging is that breast cancer is not one disease. And previously we had treated it as one disease. And we thought that if everyone had equal access to breast cancer care, there would be equal outcomes. And we now have genomic tools and better ways to diagnose and treat breast cancer. And we're finding that the disparities in outcomes continues to increase. So we're beginning to ask the question, is it really just all about access? Or is it possible that because breast cancer affects women differently, that for some women, it might be a completely different disease from what we have been accustomed to? And so that's why I think that we have to talk about access, but we also have to talk about the biology and finding new treatments for the most aggressive type of breast cancer that happens to disproportionately affect African American women.
One of the very provocative research lines that we are exploring is related to the possibility that African ancestry in and of itself might be associated with a genetic predisposition for developing certain types of breast cancer, and in particular these very aggressive forms of breast cancer. And so I and several others, such as Dr. Olopati, have been looking at African populations to compare the breast cancers that are seen in African women compared to the breast cancers seen in African American women, and then comparing these tumors to the cancers of white American women. We see that there is a more common predisposition for developing biologically aggressive forms of breast cancer in women with African ancestry. And we see this very strongly in African women. We see it strongly in African American women as well.
There's a lot of myths out there. And so what I'm encouraging women of all ethnic, racial groups to do is know about yourself, know about your risk for breast cancer, know that every woman is at risk for breast cancer. And if you're an African American woman who is at risk for the most aggressive type of breast cancer, you better be talking to your doctor about what you can do to lower your risk.
African American women indeed need to be aware of their higher risk for developing these aggressive forms of breast cancer because early detection will be the key. Regardless of what type of breast cancer a woman is diagnosed with, her odds of beating that breast cancer are greatest if the cancer is detected early. The second message is related to research. We very much need African American women to become motivated, to stay motivated to participate in clinical trials so that we can learn more about better treatments for these aggressive forms of breast cancer. And so it's exciting to partner with African American support organizations. It's exciting to partner with African research organizations so that we can learn more about these aggressive forms of cancer and perform the necessary research that will improve outcomes for women around the world.